The goal of the study was to determine trends in the disease burden for cirrhosis and HCC over a 13-year period in a national cohort of U.S. veterans. Disease burden in veterans, there's a couple of reasons why it's higher than in the rest of the country, but we do believe that our results are extrapolatable in large part to the rest of the U.S. In the case of cirrhosis, we found that 48% of patients with cirrhosis in the VA system as of 2013 have hepatitis C virus. The other big causes of disease are alcoholic liver disease and non-alcoholic fatty liver disease. All the other causes put together accounted for just 7% of the burden of disease. And over time, the prevalence of cirrhosis rose about twofold in our population. We also were trying to predict when the peak of prevalence would occur in our patients. And so if you look at the rate of diagnosis of cirrhosis compared to the expected mortality of cirrhosis, we anticipate that the peak prevalence is going to occur in about 2021. And for hepatocellular carcinoma, we found similar but more accentuated trends for hepatitis C virus. So actually in 2013, more than 2/3 of cases of HCC in veterans were caused by hepatitis C virus. And the other two big causes, NAFLD and alcoholic liver disease, were 13% and 11%, so still very important, but much smaller burden of disease. And there's been a big increase in incidence of HCC in veterans, so it's increased almost twofold over the course of the study. This was almost entirely driven by hepatitis C virus. The big elephant in the room is hepatitis C virus because it accounts for such a large proportion of disease. The other two causes are still very important. Non-alcoholic fatty liver disease, we saw an uptick in the proportion of cases of cirrhosis due to NAFLD, which is consistent with prior predictions. And also alcoholic liver disease remains a big cause of disease in the US and in veterans both. So of all of these, hepatitis C virus in many ways is the most straightforward to treat. We've got great drugs, but non-alcoholic fatty liver disease and alcoholic liver disease are important as well. And we don't have easy magic bullet solutions for these conditions. They're very challenging, require multidisciplinary teams. So if there's any positive note of our findings is that all three of the big causes of disease are treatable or at least preventable, and we know what to do if we have the will to do it. For patients with cirrhosis, the mean age of the veterans was in their 60s, and for hepatocellular carcinoma it was slightly older, and for hepatocellular carcinoma due to NAFLD, the average age was over 70 years old. So as the population ages, it'll be interesting to see what mortality rates do and whether the mortality is in fact due to liver disease or to other competing causes, because this is a group with a lot of other health problems as well. The majority of patients with cirrhosis and HCC are in the Vietnam era birth cohort, which is due to the fact that most of them, the majority have hepatitis C virus in this group. So, I think hepatitis C in younger veterans is a rising concern, but the vast majority of the cases are in our Vietnam era folks. So there's a couple of interesting follow-up studies that I'm interested in, particularly looking at the causes of mortality. I think it's easy to assume that patients are dying from their liver disease, but we don't know that, and I want to take a closer look at that. And then also trying to plan ways and strategize from policy point of view, how do we address the hepatitis C burden in veterans? And the VA has actually done a good job at outreach and at disseminating treatment to a lot of veterans, but we still have a long way to go.